Attention, doctor, what is your diagnosis?
We are afraid that young Clyde has cancer, medulloblastoma to be specific. In his MRI, we found a malignant neoplasm, or tumor, in his cerebellum. A biopsy was needed to confirm our diagnosis.
So, doctor, what will happen to Clyde? He is only 7 years old.
With luck and proper treatment, Clyde should be cancer-free in 5 years. Also, medulloblastoma only occurs in children, with 80% of those diagnosed being under the age of 10.
So, what does this proper treatment include?
This treatment includes aggressive surgery, radiation therapy, and chemotherapy.
What does aggressive surgery entail?
Well, first we will have to resect as much of the tumor as possible with invasive surgery. It is subsequent to the surgery that we will use radiation and chemotherapy.
This appears to be a very rough recovery. Are you certain that it is medulloblastoma?
I am certain, due to the lack of cytoplasm found in the cells of the tumor in our biopsy.
So, doctor, what exactly is medulloblastoma?
A blastoma is a tumor originating from cells with little to no connective tissue, and medullo means soft mirror-like center of an organ. Thus, medulloblastoma is a malignant primary brain tumor originating in the cerebellum or posterior fossa.
But doctor, how did this happen? He was such a healthy boy.
As with most brain tumors, there is no known cause. However, we believe your son's tumor could not have been prevented, as it is a result of poorly developed cells originating from an early stage in his life.
Ah, that's interesting. So what are the symptoms of said disease?
The symptoms include swelling of brain, enlarged head, personality changes, loss of motor skills, muscle weakness, impaired speech, lethargy, nausea and vomiting, crossed eyes, less control of voluntary movements, and rapid involuntary eye movements.
Oh, those are some harsh symptoms. Are you sure he will be all right?
Well, there is a small chance the tumor cells could metastasize, or spread, outside the brain via the cerebrospinal fluid, but otherwise, the prognosis is generally good, as there is a survival rate of about 80%.
Those odds are still frightening. Thank you for your help, doctor.
No need to thank me, sir. It is my job.